The patient is MC. She's a 30-year-old female. Right now, she's in room 2738 at the neurovascular unit. She came in with a hemorrhagic stroke and right temporal lobe hematoma resulting from AVM, arteriovenous malformation. She is currently stable but presents with significant neurological deficits, including left sided paralysis, hemiplegia, and decreased sensation on that left side, basically upper and lower extremities. She is full cold. She has allergies to Reglan and clomazepam or compazine. Let's see. She presented to the ED on 114 what she described as a thunderclap headache. She lost consciousness and had left sided weakness. On arrival, she was intubated for airway protection, and a head CT showed a large right temporal hematoma with a midline shift. And she underwent emergent hemocraniectomy and was later transferred to the neurovascular ICU. And then she was moved to our unit 3A neurovascular on 116. She does have a medical history of seizures, migraines, hypokalemia, and hyponatremia. She also has a history of generalized anxiety disorder and depression. She's a single French speaking is her native language, but she also speaks English. Lives in an apartment with her boyfriend. Her She has no history of tobacco, alcohol, or domestic violence. Her mother is at bedtime. Her mother stays most of the day at her bedside. She typically leaves around 4 o'clock in the afternoon. Right now, her neurological status, she's alert and oriented times two. She's only oriented to place and herself and not to time. Her Glasgow Coma scale is 15. Her left pupil is still dilated, so she's still having some pressure, but her right pupil is reacting to light. She has notable left-sided paralysis, like I said, um, from head to basically from her upper extremities, lower extremities, and sensory loss. On her head, there's sutures. The sutures are clean. Also, her head is shaved in that area, and then there's a small indentation from the craniectomy. Her cardiovascular, she's normal tensive. Her BP is 123, 83 over 83, and normal thermic 98.5. So that's good. Heart sounds S1 and S2 are clear. Lungs are clear, but the patient is also at high risk due to diminished immobility or diminished mobility. She does right now. She does have portal intake. She does have active bowel sounds, but patient is not meeting nutritional needs. And her last BM was 114, and what is described as loose stool, or actually, excuse me, 115. She is incontinent. Currently, we have a Pirwick. Her urine is colorless with sediment and froth visible, so we will continue to monitor that. She is emotionally, I wouldn't say she's emotional. She's crying frequently and grieving the loss of sensation on her inner extremities. Right now, her hemoglobin is 9.8, so that's low. We'll continue to monitor that. And hematocrit is 30.7. Likely due to she also has iron and folate deficiencies. And right now, her vitamin K is 3.8, or not, or potassium is 3.8, and the sodium is 137. So we gonna continue to monitor that. And her PT is 14.1, and INR is 1.1. She is high fall risk, and she's also severe risk for skin breakdown due to the immobility. Let's see. So my recommendations. We're gonna see. Number one, we're gonna do passive range of motion and reposition her. We're gonna do passive range of motion on her left side, and we're gonna encourage her to do active range of motion on the right side, the unaffected side. Also, we're gonna frequently reposition her every 2 hours, and we also gonna use pillows to support the affected side. Consult with physical therapy and occupational therapy in regards to that. Also, I will send a request for social worker to find out some resources for her as far as any assistive device that she can use. And then also with the PT, we're going to continue to monitor for contractures in that affected side. And then also the range of motion will help with the reduce the risk of pressure injuries. And then we're going to consult with the social worker basically for professional rehabilitation plan, rehab plan for acute care. We're also going to recommend the patient receive home care services. Also, the patient is at risk for aspiration. Right now, like I said, her nutrition is low, but we're going to have speech therapists continue to assess her gag reflex and cough reflex and lung sounds. But also recommend that if she's okay to eat, we're going to recommend that nutrition cut her food up in small pieces if that's possible, but also thicken her liquids for now. Also, I said that if she continues not to eat, we're also going to request from the doctor that she have some kind of TPN or NG tube feedings if she continues not to eat. So we're going to continue to monitor that. And then also we're just going to continue to make sure that the patient is not at risk of aspirate or doesn't aspirate during the shift. We're going to continue to do neurological assessments on her affected side to see if there's any sensation during the shift. Continue to monitor that. We also going to keep her feet elevated to reduce the risk of skin breakdown. We're going to reposition the patient every 2 hours and place barrier pads under the bony prominences. And anytime there's any type of wet or damp linens, we're going to change that immediately. So the patient is currently on seizure precautions. So make sure that a suction and ambu bag are present at the bedside. Fall prevention, so we're going to keep the bed at the lowest and lock position and call light on the unaffected side. And we're going to continue, like I said, to monitor her level of consciousness and orientation. And then also recommend that she use SCDs and compression socks to prevent thrombus formation due to immobility.